We have overcome many pandemics and crises before. We will overcome this one too. The question is how large a price we will pay. Already, we have lost more than 16,000 lives. We know we will lose more. How many more will be determined by the decisions we make and the actions we take now. To slow the spread of COVID-19, many countries have contributed or introduced unprecedented measures at significant social and economic cost, closing schools and businesses, cancelling sporting events, and asking people to stay home and stay safe. We understand that these countries are now trying to assess when and how they will be able to ease these measures. The answer depends on what countries do while these population-wide measures are in place. Asking people to stay at home and shutting down population movement is buying time and reducing the pressure on health systems. But on their own, these measures will not extinguish epidemics. The point of these actions is to enable the more precise and targeted measures that are needed to stop transmission and save lives. We call on all countries who have introduced so-called lockdown measures to use this time to attack the virus. You have created a second window of opportunity. The question is, how will you use it? There are 6 key actions that we recommend. First, expand, train, and deploy your healthcare and public health workforce. And second, implement a system to find every suspected case at community level. Third, ramp up production capacity and availability of testing. Fourth, identify, adapt, and equip facilities you will use to treat and isolate patients. Fifth, develop a clear plan and process to quarantine contacts. And finally, number 6, refocus the whole of government on suppressing and controlling COVID-19. These measures are the best way to suppress and stop transmission so that when restrictions are lifted, the virus doesn't resurge. The last thing any country needs is to open schools and businesses only to be forced to close them again because of a resurgence. Aggressive measures to find, isolate, test, treat, and trace are not only the best and fastest way out of extreme social and economic restrictions, they are also the best way to prevent them. More than 150 countries and territories still have fewer than 100 cases. By taking the same aggressive actions now, these countries have the chance to prevent community transmission and avoid some of the more severe social and economic costs seen in other countries. This is especially relevant for many vulnerable countries whose health systems may collapse under the weight of the numbers of patients we have seen in some countries with community transmission.